Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. How can I assist you today?
Hi, I'm not feeling well. I have a high fever, cough, sore throat, and body aches.
I see. Can you please tell me your name and age, and when did you first notice these symptoms?
My name is Maya, and I'm 32 years old. I started feeling unwell 3 days ago, and my symptoms have been getting worse since then.
Do you have any past medical history that I should be aware of?
Yes, I have a history of asthma.
All right. Thank you for letting me know. Does anyone in your family have a history of any illnesses?
My father has diabetes, and my mother has high blood pressure.
Okay. Thank you for that information. Do you have any allergies that you know of?
No, I don't have any known allergies.
I will now take your vital signs to assess your condition. Your blood pressure is 120 over 80 millimeter Herdrangs. Your heart rate is 100 beats per minute, and your body temperature is 102.5 degrees Fahrenheit. Based on your symptoms and vital signs, it seems like you may have the flu.
Oh no, that's not good.
Yes, it's important to take care of yourself and prevent the flu from spreading. You should rest, drink plenty of fluids, and take over-the-counter pain relievers as needed. I also recommend that you stay home and avoid contact with others until you are feeling better.
Okay, I will do that.
If your symptoms worsen or persist for more than a week, please come back for a follow-up visit. Thank you for coming in today, and I hope you feel better soon.
Thank you, doctor.
Sarah, before you leave, I want to make sure you understand how to manage your symptoms at home. First, it's important to stay hydrated by drinking plenty of water and clear fluids like broth, tea, or sports drinks. Avoid caffeine and alcohol, as they can dehydrate you.
Okay, I will drink more fluids and avoid alcohol and caffeine.
Good. Also, make sure you get plenty of rest. Your body needs time to recover, so try to avoid any strenuous activities and get enough sleep.
I will definitely try to rest more.
If you have a cough, you can take over-the-counter cough medicine to help relieve it. If you have body aches or a fever, you can take over-the-counter pain relievers like acetaminophen or ibuprofen.
That sounds helpful. How often can I take the medicine?
Follow the instructions on the label or as directed by your pharmacist. Typically, you can take acetaminophen every 4 to 6 hours and ibuprofen every 6 to 8 hours. Be careful not to exceed the recommended dose, as taking too much can be harmful.
Okay, I will be careful with the dosages.
Finally, it's important to prevent the spread of the flu to others. Cover your mouth and nose when you cough or sneeze, and wash your hands frequently with soap and water.
I will definitely do that. Thank you for the advice, doctor.
You're welcome, Sarah. If you have any further questions or concerns, don't hesitate to contact me or come in for a follow-up visit.
I will. Thank you again, doctor.
Take care, Sarah, and get plenty of rest.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. May I know your name, please?
Yes, my name is Sarah.
Hello, Sarah. What is your age?
I am 34 years old.
Can you please tell me the reason for presenting to the hospital today?
Yes, I have been experiencing some symptoms for the past few weeks. It started with a rash on my skin, which has now spread to other parts of my body. I also have a fever, diarrhea, and my appetite has decreased.
Thank you for the information. Can you please tell me about your past medical history?
I had a bone marrow transplant a few months ago due to leukemia.
Thank you. Can you tell me about your family history of illness?
My father had diabetes, and my maternal grandfather had a heart attack.
Thank you. Can you also tell me about your social history and any allergies that you have?
I don't smoke or drink alcohol, and I don't have any known allergies.
Thank you. Can you describe the symptoms you've been experiencing in more detail and the timeline of when they started and how they have progressed?
The rash started about 3 weeks ago and has been getting worse. It's red and itchy, and it's now on my arms, legs, and stomach. The fever started a few days after the rash and has been on and off. The diarrhea started about a week ago, and it's been getting worse. I feel weak and tired all the time, and I've lost a lot of weight.
Thank you for that information. I will now do a physical examination. Can you please raise your arm so that I can take your blood pressure?
Yes, sure.
Your blood pressure is 120 over 80 mmHg, and your heart rate is 100 beats per minute. Your temperature is 38.5 degrees Celsius. Based on your symptoms and medical history, I suspect that you may be suffering from graft versus host disease. This is a condition where the transplanted bone marrow cells attack the body's own cells. We will need to do some investigations, such as blood tests and a biopsy, to confirm the diagnosis. In terms of nursing management, we will need to monitor your fluid and electrolyte balance, as well as your nutrition. We will also need to manage your symptoms, such as the diarrhea and rash. I will prescribe you some medications, including corticosteroids, to reduce inflammation, and an immunosuppressant to suppress the immune system. We will also give you antibiotics to prevent any infections. Once your condition stabilizes, we will start planning your discharge from the hospital. You will need to come for follow-up appointments and regular blood tests to monitor your progress.
Thank you, doctor. Can you please tell me more about graft versus host disease and how it can be treated?
Sure. Graft versus host disease occurs when the donor bone marrow cells recognize the recipient's tissues as foreign and attack them. This can cause damage to various organs, including the skin, liver, and intestines. Treatment for graft versus host disease usually involves medications to suppress the immune system, such as corticosteroids or immunosuppressants. In severe cases, photopheresis, a procedure that uses ultraviolet light to suppress the immune system, may also be used. It's important to monitor and manage the symptoms of graft versus host disease, such as the rash, diarrhea, and fever, as well as any complications that may arise, such as infections or organ damage.
I see. How long does it typically take to recover from graft versus host disease?
The recovery time can vary depending on the severity of the disease and the individual patient's response to treatment. In some cases, graft versus host disease can be managed with medication, and symptoms can improve within a few weeks or months. In other cases, the disease may be more severe and require more intensive treatment, which may take several months to a year. It's important to closely monitor the patient's condition and adjust the treatment plan as needed to ensure the best possible outcome.
That makes sense. What can I expect during my hospital stay and after I am discharged?
During your hospital stay, we will monitor your symptoms, manage any complications that may arise, and adjust your treatment plan as needed. We will also provide you with supportive care, such as nutrition and pain management, to help you feel more comfortable. After you are discharged, you will need to come for follow-up appointments and regular blood tests to monitor your progress. It's important to take all medications as prescribed and to report any new symptoms or concerns to your healthcare provider. We will also provide you with information on how to manage your symptoms at home, such as how to care for your skin and manage diarrhea. We will work with you to develop a plan for your ongoing care and ensure that you have the resources you need to manage your condition.
Thank you, doctor. That is very helpful information. What can I do to help manage my symptoms and promote my recovery?
There are several things you can do to help manage your symptoms and promote your recovery. It's important to get plenty of rest, stay hydrated, and eat a healthy, balanced diet. You should also avoid exposure to germs and infection, as your immune system will be weakened by the treatment. It's also important to follow your treatment plan as prescribed and report any new symptoms or concerns to your healthcare provider. With the right treatment and care, we can work together to manage your condition and promote your recovery.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Good morning, Mr. Johnson. I understand that you've been referred to me because you may be suffering from diabetes. Can you give me some background information?
Yes, that's right. I've been experiencing frequent urination and increased thirst lately, and my doctor said that it might be due to diabetes.
I see. Have you noticed any other symptoms?
Well, I've been feeling very tired lately, and I've lost some weight without really trying. Also, my vision seems to be getting worse.
Those are all common symptoms of diabetes. Have you had any blood tests done?
Yes, my doctor did some tests, and my blood sugar levels were high.
Okay, that confirms the diagnosis of diabetes. Now, it's important to manage your condition to avoid complications. Have you made any changes to your diet or lifestyle?
I've been trying to eat healthier and exercise more, but it's been difficult to stick to a strict routine.
It can be challenging, but it's important to manage your blood sugar levels. Have you been monitoring your blood sugar at home?
Now look at question 26.
I am glad to have the opportunity to speak to you today about the importance of oral health in overall health. As a dentist, I have seen firsthand the impact that poor oral health can have on a person's overall well-being. Many people tend to think of oral health as just keeping their teeth clean and cavity-free. However, oral health goes far beyond just the health of your teeth and gums. It can have a significant impact on other aspects of your body, including your heart, lungs, and digestive system. One of the most significant links between oral health and overall health is the connection between gum disease and heart disease. Studies have shown that people with gum disease are more likely to develop heart disease than those with healthy gums. This is because the bacteria that cause gum disease can enter the bloodstream and travel to other parts of the body, including the heart. Once there, they can cause inflammation and damage to the heart and blood vessels.
Now look at question 27.
In most cases, hospitalization is not necessary for treatment of hepatitis C. However, in some cases, hospitalization may be required if the patient has severe symptoms or complications related to the disease. In your case, we will need to monitor your symptoms closely, but you should be able to manage the treatment on an outpatient basis.
Will I need any follow-up visits after my treatment?
Yes. Follow-up visits will be necessary to monitor your progress and ensure that the treatment is working effectively. We will need to perform blood tests to check your liver function and to make sure that the virus has been successfully treated. Depending on your response to the treatment, we may also need to adjust the duration or type of medication that you are taking.
Will I need to make any lifestyle changes during my treatment?
Yes, it is important to make certain lifestyle changes to help manage the disease and prevent further liver damage. This includes avoiding alcohol and drug use, maintaining a healthy diet, getting regular exercise, and practicing good hygiene to prevent the spread of the virus to others. We will provide you with more detailed instructions on how to manage your condition during your treatment.
Can hepatitis C be cured completely?
Yes, hepatitis C can be cured completely with the right treatment. However, the success of the treatment depends on various factors, such as the severity of the disease, the type of medication used, and how well the patient responds to the treatment. It is important to follow your treatment plan and attend all follow-up visits to ensure the best possible outcome.
Now look at question 28.
As a physiotherapist, I have witnessed the power of physiotherapy in improving the quality of life of many patients. Whether it's helping someone recover from an injury or managing a chronic condition, physiotherapy can play a vital role in restoring function, mobility, and independence. Physiotherapy is a healthcare profession that focuses on the assessment, diagnosis, and treatment of musculoskeletal, neurological, and cardiorespiratory conditions. Physiotherapists are trained to use a variety of techniques and interventions to improve movement, reduce pain, and enhance physical function. When it comes to rehabilitation and recovery, physiotherapy can be beneficial in several ways. First and foremost, physiotherapy can help to alleviate pain and discomfort. Pain can be a significant barrier to recovery, and physiotherapy interventions such as manual therapy, exercise, and modalities like ultrasound and electrical stimulation can help to reduce pain and improve function.
Now look at question 29.
Are there any side effects to the treatment options?
Some medications can have side effects, but we will monitor you closely to ensure that any side effects are managed effectively. It's important to follow the treatment plan closely to improve your quality of life and prevent complications.
Thank you. I'm willing to do whatever it takes to manage my symptoms and improve my health.
That's great to hear, Mr. Johnson. It's important that we work together to manage your symptoms and prevent future headaches. In addition to lifestyle changes and medication, there are some other treatment options that we may explore depending on the severity and frequency of your headaches.
What other treatment options are available?
One option is nerve stimulation therapy, which involves implanting a small device under the skin to send electrical impulses to the nerves that may be causing your headaches. Another option is Botox injections, which have been shown to be effective in reducing the frequency and severity of migraine headaches.
That's interesting. How do these treatments work?
Now look at question 30.
Good morning. How can I help you today?
Hi, I'm here for my regular checkup and cleaning.
Great. It's always good to see you. So how has your dental hygiene been since your last visit?
Honestly, I've been slacking a bit. I've been busy with work and haven't been brushing and flossing as much as I should.
I understand it can be tough to find the time, but maintaining good dental hygiene is crucial for your oral health. Poor dental hygiene can lead to tooth decay, gum disease, and even tooth loss. Did you know that gum disease has also been linked to other health problems, such as heart disease and diabetes?
I didn't realize it was that serious.
Yes, it's important to take care of your teeth and gums to maintain good overall health. Regular brushing and flossing, as well as routine dental checkups and cleanings, can prevent these issues from developing.
That makes sense. I'll make sure to be more consistent with my dental hygiene routine.
That's great to hear. And don't forget to pay attention to your diet too, as sugary and acidic foods can also contribute to tooth decay and gum disease.
I'll keep that in mind. Thanks for the advice.
Of course, and let's get started on your cleaning. We'll make sure to give you some tips on how to improve your dental hygiene at home too.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today we're talking to Dr. Sarah Lee, a dermatologist and acne specialist in the USA. Dr. Lee, could you explain to our listeners what acne is and why it is such a common skin condition?
Acne is a skin condition that occurs when hair follicles become clogged with oil and dead skin cells, leading to the formation of pimples, blackheads, and whiteheads. It is most commonly associated with adolescence, but it can affect people of all ages. The reason why acne is so common is because of the increased production of sebum during puberty, which can lead to clogged pores. In addition, hormonal changes, stress, and certain medications can also contribute to the development of acne.
Can you describe the different types of acne and their severity?
There are 2 main types of acne, inflammatory and non-inflammatory. Non-inflammatory acne includes blackheads and whiteheads, while inflammatory acne includes papules, pustules, nodules, and cysts. The severity of acne can range from mild to severe. Mild acne includes the occasional pimple, while severe acne can cover the face, chest, and back with painful cysts and nodules.
How can acne be treated, and what are the most common treatments?
Acne can be treated through a combination of topical and oral medications, as well as lifestyle changes. Topical medications include retinoids, benzoyl peroxide, and antibiotics, while oral medications include antibiotics, hormonal treatments, and isotretinoin. In addition, lifestyle changes such as maintaining a healthy diet and avoiding certain cosmetics can also help to manage acne.
Are there any concerns with treating acne, such as side effects of medication?
Yes, some medications used to treat acne can have side effects such as dryness, redness, and irritation of the skin. In addition, some oral medications can have more serious side effects, such as liver damage or birth defects. It is important to discuss the risks and benefits of treatment options with a healthcare provider.
Can acne be prevented, or are there any ways to reduce its severity?
While acne cannot be completely prevented, there are steps that can be taken to reduce its severity. This includes maintaining a consistent skincare routine, avoiding touching the face, and avoiding harsh chemicals and abrasive scrubs. In addition, stress management and maintaining a healthy diet can also help to manage acne.
Lastly, are there any misconceptions about acne that you would like to clear up?
Yes, there are a few common misconceptions about acne. One is that it is caused by poor hygiene, when in fact, it is caused by a combination of factors, including genetics, hormones, and bacteria. Another is that popping pimples is a good way to get rid of them, when in fact, this can cause further inflammation and scarring. It is important to treat acne with patience and consistency, and to seek the advice of a healthcare provider for effective treatment options.
Thank you for clearing up those misconceptions about acne, Dr. Lee. Can you explain how genetics play a role in the development of acne?
Sure, genetics can play a significant role in the development of acne. Research suggests that certain genes may make individuals more prone to developing acne, as it can be passed down from parents to their children. This is why acne tends to run in families. However, it is important to note that genetics is just one factor in the development of acne, and it can also be influenced by hormonal changes, stress, and environmental factors.
You mentioned that stress can contribute to the development of acne. Can you explain how that works?
Yes, stress can contribute to the development of acne by triggering the release of certain hormones in the body, such as cortisol. These hormones can stimulate the oil glands in the skin, leading to an increase in oil production and clogged pores. In addition, stress can also lead to behaviors such as touching the face and picking at pimples, which can exacerbate the condition.
That's interesting. Are there any dietary factors that can contribute to the development of acne?
While the link between diet and acne is not fully understood, some studies suggest that high glycemic index foods and dairy products may contribute to the development of acne. High glycemic index foods such as white bread, pasta, and sugary drinks can cause a rapid spike in blood sugar levels, which can lead to an increase in insulin production and the release of certain hormones that can contribute to acne. Dairy products, on the other hand, contain hormones that can stimulate the oil glands in the skin.
That's good to know. Are there any natural remedies for acne that people can try at home?
While there is no cure for acne, there are some natural remedies that may help to reduce its severity. For example, tea tree oil has been shown to have antimicrobial properties and can be applied topically to the skin. Aloe vera and honey are also known for their anti-inflammatory properties and can be used as a soothing mask for the skin. However, it is important to note that these natural remedies may not work for everyone, and it is best to consult with a healthcare provider before trying them.
Thank you for those natural remedy suggestions. Lastly, is there anything else that people with acne should know?
Yes, I would like to emphasize the importance of seeking professional advice for the treatment of acne. While it can be tempting to try over-the-counter products or natural remedies, it is important to remember that acne is a medical condition that should be treated by a healthcare provider. In addition, it is important to be patient with the treatment process, as it can take several weeks or months to see improvement. Consistency is key, and sticking to a skincare routine and treatment plan can help to manage acne effectively.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
As a doctor, it is my utmost pleasure to speak with you today about a global health concern, hepatitis. Hepatitis is a condition that affects the liver and is caused by a viral infection. It can be of 5 types: hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. This disease can range from mild to severe and can lead to chronic liver disease or even liver cancer. Hepatitis A is caused by the hepatitis A virus and spreads from fecal-oral contact with an infected person or through ingestion of contaminated food or water. Hepatitis A usually resolves within a few weeks with proper rest and adequate nutrition. Hepatitis B is caused by the hepatitis B virus and spreads through sexual contact, sharing of needles, or through birth if the mother is infected. Hepatitis B can lead to chronic liver disease and is the cause for 80% of all liver cancer cases worldwide. The vaccine is available for hepatitis B virus and should be taken as a preventive measure. Hepatitis C is caused by the hepatitis C virus and spreads through contact with the infected blood of an infected person from sharing needles or blood transfusion. It can lead to liver cirrhosis and cancer if left undiagnosed and untreated. There are direct-acting antivirals available that can cure the disease with proper medical guidance. Hepatitis D is a severe form of hepatitis that only affects people who are already infected with the hepatitis B virus. It spreads through sexual contact or sharing of needles. It can be prevented with the same vaccine that is available for hepatitis B. Hepatitis E is caused by the hepatitis E virus and is spread through contaminated food or water. It primarily affects the developing countries and can lead to acute liver damage. Proper sanitation methods and adequate hygiene should be practiced in these countries to prevent the spread of the virus. Hepatitis is concerning due to its silent nature, often presenting no symptoms until the later stages, when it can be too late to do anything about it. However, it is treatable and curable, provided the diagnosis is done in time. Thus, it is essential to know the signs and symptoms of hepatitis. The common symptoms of hepatitis include fatigue, loss of appetite, fever, abdominal pain, and jaundice. If these symptoms persist, it is advisable to seek medical help. Also, it is important to note that hepatitis can be present without symptoms, and one should get tested for hepatitis if they have had any risk factor exposure. Prevention is always better than cure, and the same goes for hepatitis. Proper hygiene and sanitation, such as washing hands before and after meals, practicing safe sex, avoiding the sharing of needles, and eating clean and cooked food can help in preventing the spread of hepatitis. Proper vaccination for hepatitis A and hepatitis B is recommended for everyone, especially for people who are at high risk, such as healthcare workers, people who travel frequently to developing countries, and people with compromised immune systems. A recent case study conducted in India reported that even though the prevalence of hepatitis B in the general population was low, several high-risk groups, such as healthcare workers and injection drug users, had a much higher prevalence of the disease. This highlights the importance of targeted vaccination programs for these at-risk groups. Current research is focused on improving the diagnostics for hepatitis, as well as developing new treatments for hepatitis C and D. Researchers are also exploring the potential of using gene editing technologies to cure hepatitis B. In the future, it would be beneficial to have more widespread screening for hepatitis, especially in at-risk populations, to ensure early detection and treatment. Additionally, there needs to be increased awareness and advocacy about the disease, especially in developing countries, where sanitation and hygiene can be major factors in the spread of the disease. Hepatitis is a serious global health concern that can have severe consequences if left undiagnosed and untreated. With proper awareness, prevention, and treatment, we can work towards reducing the prevalence and impact of this disease. Remember to get vaccinated, practice good hygiene, and get tested if you have any risk factor exposure.